It's such a privilege to be part of this incredible team. And I'm just reminded as you guys were all going through your organizations, like what an incredible team we are together, and all the different things that we bring to this training and this collaboration. And so I am the practice director of the Institute for Therapy Through the Arts. And we are a nonprofit creative arts therapy center. So we provide exclusively creative arts therapy. So everyone at our center who is employed as a therapist is a credentialed creative arts therapist in one of the different art forms. So we were started in 1975, and we have developed and grown quite a bit. So we are an organization primarily in Evanston, but we have locations in Highland Park, and we are expanding to a Chicago location, hopefully in the next year. So we provide individual therapy, family therapy, group therapy, and all of these things on the one, in those moments of using the arts to work on the healing components. So a little bit about me and how I got into this work. I am an art therapist. I'm also a psychologist, and my interest in art really started for me in high school, where it was really impactful for my personal life and in my personal process, and reached this understanding for myself of what the arts can do for us as human beings and our communities, and how we can process through them. And when I started to think about my career choice and what I wanted to do, is I really wanted to harness that creativity, as so many of you do, so many of you on this call, to better the greater collective, the greater community, whether it be through arts education or arts therapy. The way that I have experienced it is, arts education is really kind of the first responders to all that is going on with using the arts in terms of how the healing works, because you're the ones with the young kids. You're the ones in the day-to-day classrooms, and we are harnessing it on our end, unfortunately, when things have occurred, and then the healing becomes therapeutic. But the healing is already there. So I would love to work with you, and the team that I will bring with us for these trainings all understands the arts themselves. We are all, as creative arts therapists, required to have education in our art form. So as an art therapist, I have education in art itself prior to the therapeutic components. So it's really helpful for us to be able to understand a bit about what that process actually means to create art, to be an artist, and then the psychological layers to that afterwards. So I have personally I have a master's degree in art therapy. I also have my doctorate in clinical psychology, and I specialize in post-traumatic stress disorder. So I did a 2-year postdoc at the Post-Traumatic Stress Center in New Haven, Connecticut. And I was part of a research study at Yale University, working with Holocaust survivors and their narratives. So I personally have done these trainings. Courtney, if you could, for the next slide, please. I was invited by the Chicago Community Trust in 2018 to develop trauma-informed arts for arts educators. And I had the wonderful privilege with working with many Chicagoland arts education programs. And here's a few that I've worked with, and some that have contracted with me separately to do this training. And my work, and what I'm so excited about this project, is continuing to develop it, to take the information of what you guys are experiencing as first responders, really in the classrooms with these kids, and helping us develop this curriculum of what this can look like, as how do we interact with the art around trauma, and how does trauma come out through the arts? It's a little bit of both. And how do we help the teachers manage what's happening in the classroom? And how do we help the student manage what's coming out? Because that's also helping simultaneously. So this is a collaborative effort between all of these different components simultaneously. Is both arts education, the arts pieces that you need to teach them, the psychological pieces that are coming out, and how do we handle those moments, those relationship pieces between you and the student, between the student and the school, the student and the community. And how do all of those things really intersect in those moments? So if you would go on to that, I'm going to explain a little bit further through some art. And I'm sure many of you have experienced this as arts educators, and wouldn't disagree with me about this, but a lot of times as an art therapist, we say a projection of ourself is in our art. And I should have made a little poll about this, but I'm sure if I did that, everyone who's an artist would say that a part of themselves is in their art in some capacity, whether that be the amount of time or effort that one spent to make the piece, or even a part of their personal narrative is there, right? So you could be standing in a classroom and a student is sharing a piece, and it could be as intense as this piece in front of me, and you don't know what it's about. They don't necessarily verbalize exactly what the art is about in that moment, but you know, as an arts educator, there's something in this piece. Something of themselves is here. You know, because we're all trained to see it and we can feel it, right? How do you handle in those moments, and I'm sure all of you have faced this in some way, the classroom's response, whether it be other students, your personal response, what's happening to you in that moment? You're seeing it, not sure what's happening. You're maybe some nervousness about what do I say? How do I help this student explain what's going on? But also protect them from potentially other students in the room who may not be as sensitive. Or if they want to showcase it, if it's an audience that they're showing this to, how do I create an environment that's safe for their emotional expression that's coming out? So these are the kinds of things that, beyond just the trauma education, which is a big part of what you're going to gain in this process and in this collaboration, but also it's in those moments, what works, what doesn't work, what are some guiding principles you can provide your educators for yourself, because we don't always know what the exact right thing to say is, but we have a group of professionals and a group of other educators that are coming together and talk about and really give some this is some guidance, so that way people who are new to this profession or an agency that's looking and growing in trauma-informed practices really have some basis for what they're approaching and how they're approaching things like an art critique or a personal expression that's coming out in the space. The next slide, okay. So sometimes also what happens is it's not just the personal responses that are coming out. Sometimes you actually get content. And so having done this training quite a bit with arts educators, you as arts educators will get information that then you have to hold and figure out what to do with. And all of a sudden a student is saying things and you're like, this is way above my training level. And this happens because you've created that relationship. The art is bringing it out. And this piece that I'm sharing with you was a student who shared a story about a sexual assault that happened in the auditorium at school. And here you are hearing about something that happens at school. And then what? What do you do next? What do you say? What do you do? What's the policies of the school? Did it just happen? Did it happen 5 years ago? And the raising of your mind, as well as that student's safety, emotionally, physically, because they might be having tears, anxiety, fear that it might happen again. Any of this thing it could have happened yesterday or could have happened 10 years ago for some of these students. So really gauging and creating a group that can come together in these workshops to really help and support each other, and continued support even following these trainings, because you're going to meet each other. You're going to work together on this guide. This guidebook is going to come from your thoughts and your experiences, shaped by those of us who are helping to write it, and future meetings could potentially come to continue to support. How do we respond to these situations? Because this isn't the first student, and this will not be the last student. As much as I would love for trauma to stop, we are at a place where trauma is happening around us with what's happening in the world. So we need to find and use the arts, as we know, to help these kids process, to explore their own sense of creativities, to use it to help for healing and help the educators yourselves facilitate that in a healthy ways for the kids and a healthy way for you and the organization and potentially the community. Thank you so much for allowing me to participate in this. I am super excited to meet with all of you and to really start this collaboration of really processing these moments and figuring out what the next steps are for you and for your teams.